Hello and welcome back to our Center Institute 10-minute training. So today we're going to be talking about alleviating musculoskeletal pain with a microcurrent. This is a very broad topic here, okay? Musculoskeletal pain is pain that affects the muscles, the bones, the joints, the ligaments, the tendons, and all of the structures that support our body. So one could argue that this is pretty much all kinds of pain. It can occur anywhere in the body, and it can feel like an ache, a burn, a stiffness, or even a soreness. Musculoskeletal pain can also be short-term. You could wake up with a sore shoulder that goes away within a few days, or it could be long-term, which would be your chronic pain. And this is going to dictate treatment to a certain degree. So where do we begin with this? Now, depending on where a client's musculoskeletal pain is, this is going to determine where I would go first. Now, the first thing is I'm going to be always looking at alignment and posture, but this is specific to location of discomfort. If a client is struggling with anything hip, back, or shoulder related, I'm going to want to look first at, you might have guessed it, the Realignment Protocol. Realignment works so quickly that for the short effort required, it can make a huge difference, especially in cases of compensation, where someone's alignment is forcing them to compensate in a different way when they're moving or performing daily actions. So let's take a look at the Realignment Protocol for a moment here. I'm just going to share my screen here so you can see the protocol. Hold on a second. Okay, so there you find it. So this is actually in Current Medicine 3rd edition. We have videos on this as well. But the Realignment Protocol is on page 111, and it's part of the lower back pain protocol, but it's usable for so many different things. Now, this is going to take into account the body mechanics, and so if your body is out of alignment, you've got to imagine yourself kind of like a puppet, right? If you lift up one side of the string of the puppet, one side of the body lifts up, but that leaves the other side lower. And so even a small misalignment of an inch, so 1 inch higher of your shoulder, means that that same leg is going to be 1 inch higher than the other. What this means is that as you're walking, you're going to have to be kind of trundling along like this. And so your body continues to compensate to the point where the muscles start to hurt in different areas because they're having to tense up to essentially compensate for what you are doing. And this can lead to long-term injury as well. So when you're doing this on a client, you want to functionally measure the leg alignment of the client. The best way to do this is to get the client to lay face down on a massage table. And essentially, while placing your thumbs above their ankles, you can essentially put these together and see where you line up with your thumbs. If your thumbs line up perfectly, this means that the client is perfectly in alignment. But when you pull their legs straight and you push your thumbs together, if one thumb is above the other, that's going to show you, whichever thumb is higher, the shoulder that is higher. Now, we want to use 60 hertz or assess 60 hertz or even relax assess for this. Anything that is in that 60 hertz range, if we can. The reason for this is that 60 hertz is the frequency that best gets the body's reaction. It's your biofeedback connection with the brain, the one that works the best. Now, you're going to just adjust the power to comfortable on the patient, and you're going to paint over the shoulder. You want to do front and back. Kind of look at this picture here. So whichever shoulder is higher, you're going to do the front and the back, and I would often go down the side of the shoulder as well. And then what you're going to do after that is you're going to go to the opposite hip. This means that if a right shoulder or a left shoulder is higher than the other, then you go to the corresponding hip on the other side. So my right shoulder's higher, then my left hip gets the treatment as well. And it's the same thing. Wrap around the hip bone, down the side of the leg, onto the glutes, and just kind of work on that area, getting rid of sticky spots. You only need to do this for about 1 minute to 2 minutes on the shoulder and on the hip. At this point, you can use the ankle method again to check your client's realignment, and you're likely going to see that they have actually already realigned themselves. It's going to have shifted, maybe even to completion of getting them back in place. All right, so we've got a little bit more that we need to talk about here as well, because it's not just about realignment. This may be the first way I will go, but I'm also going to want to look up, if it's structural, little wings. Now, little wings is something that you either hate or you love, but it is fairly easy to do once you start to see it done on a patient. And in the CPRS program, we've got some videos where we go through that specifically. But using 121 hertz, you essentially align the electrode up behind the ear and you drag it down into the neck. And you want to go right where the neck meets the shoulder. So it's not just down on the neck, it's actually meeting the shoulder as well. Then you're going to adjust the power until you can feel it. So you want to feel that kind of tug, and you're going to start to see the shoulder lift. So let me move my arm a little bit here. So it's going to be, because of the modulation, it's going to be pulling on the shoulder, as you can see. And it's going to drop, and then it's going to pull again. Now you want to allow it to do 5 flaps, as we call them. So this will be flap number 4, hence little wings. And then it's going to go up again. And you can see it's struggling a bit today, actually. Usually mine goes up way faster than this. And then you switch to the other side, kind of behind here. I don't usually put it in contact because of the current. Go right down there and put that in. And you can get your 5 flaps on this side. And I actually have to do this because you never want to leave one side done, even if you're just demoing the treatment, because you need to be able to make sure you're aligning on both sides. So I would do this after the realignment protocol, just to be sure, if you know there's something that's going on with alignment. Okay, so finishing this one up here. Okay, now, what would we do next? Because that's not necessarily it. You would want to follow up with direct treatment on the area where the person is experiencing that discomfort. And so really, if I had a pinnacle on hand and it was less than 72 hours since this issue started, I would use Sana trauma. If I only had an evolution, I would look at 350 hertz. And if I had a Genesis or Genesis 2, I would use blue stimulation. Set the power to comfortable and work over the area that hurts, getting rid of those active zones. It really is that simple. If the issue was chronic, it's still going to warrant the realignment and the little wings. But instead, I would be looking at using the modes like 350 and blue stim more than I would Sana trauma, because it's no longer an acute issue. So that covers what happens if it's a structural issue. If we're kind of looking at, well, it's the back and hip and shoulder related, and there's obviously some misalignment going on. But what if the musculoskeletal pain is not localized to the hip or the shoulders or the back? What if it was like elbow or even wrist pain? So in these cases, it can feel like more of a challenge because we don't have the kind of catch-all completion of just, let's just get this to work. So here, we're going to be relying on a mode like FMRSI. Now, this can be used for chronic and acute issues, but FMRSI can release a lot of pressure. It's a very powerful mode. What we really want to do, though, is we want to get the brain involved. Just like with realignment, where we're getting the brain to pay attention, we want the brain to get involved in this situation and see that something is going on. So what we would do is, using FMRSI, switching out to that mode, we would essentially adjust the power to comfortable on the wrist. So once we've done this, what we're going to do is we're going to be able to feel, we need to be able to feel the power. Okay. And then what we want to look for, and it's going to be hard to kind of show it while doing it, but what we want to look for is we want to look for a dose. So on the evolution, that's going to be the blue light coming on, and then we want a 0 followed by all the greens. With the pinnacle, that's going to be the D and followed by the Z. So this can obviously take time. So we need to be able to release that discomfort. And I don't know if it's even going to happen on this video. What I will say as well is that another option is to do the good side. So if this side is not helping, so you see I got a failed Z there. So I'd have to try it again. So if this side is not helping, then what you do is you go to the other side and you would perform the same process. Now, FMRSI is usually going to get this to go in the end simply because it is putting a lot of energy into the body. So it's going to start to make the cells respond. But as you're seeing in this case, and you can never predict this, right? the body is just not thrilled with trying to get that signal to the brain. It's just not working. So what's happening is I'm getting a ping back before the brain has opened the door. And that's where these consistent greens are coming from. So the hope is, there we go, that we get that dose. So eventually consistency matters, right? And now we're going to wait for all the green lights to come on to experience the Z. There we go. That was almost perfect. So a dose and a zero mode happening in this case allows us then to switch to a blue stimulation and to do 2 minutes of stimulation on the area of discomfort. Now, really what we want to do here is just make sure that we're getting the brain involved in the process. Musculoskeletal pain tends to be a brain memory thing. You're compensating and you don't even know it. And so you need the brain to recognize what is going on in the area and to adjust itself and make those corrections. All right, so hopefully you found this training helpful and useful. We will be doing another one next week, so I hope you'll join me then. Otherwise, I hope you have a great weekend. Thanks for watching, everyone. Take care.